and welcome back to Healthy Living. I'm here at the KUAM Memorial Hospital with Patient Safety Awareness Committee Chair Danielle Manglona. We're here to talk about an overarching issue affecting all hospitals, which is patient safety. So, what should a patient know when going in to receive care at a hospital?
Well, the first thing they do is they'll pass through a patient registration process, and they'll get their identification verified, and they'll get a identification bracelet placed onto their wrist. That information is very important as we use it to identify the patient during blood transfusions, medication administration, anytime we draw labs or do a type of imaging study. Also, when patients come in, we do an assessment. We ask them their history, any medications that they're taking, and actually bringing in a list of all the medications that they take, as well as when they take them throughout the day is very crucial to have as well. Helps us to know which medications we need to prescribe when they're here. That way we can help continue any type of regimen that they need, as well as if we're prescribing anything new, that they don't interact with something that they're already taking. So that's very important for them to do. If we give medications here, then we involve the patients in their care and that we educate why they are taking it. And if at any point anything does not appear to, or is not clear to them, they don't understand, or it's something new that they haven't encountered before, like a new medication is prescribed, and they sorry.
It's okay. Well, a lot of times this is just people take it for granted. They just go in and they don't really think twice about patient safety. They just kind of assume it's being provided. So, why is it important? You mentioned that people should be more proactive. Why is it important that they take a more proactive approach with their safety?
It's because it's their body. They only have one of them, and it's very important. The doctors and nurses, everyone that works here, we work every day for patient safety. However, healthcare is human-based, and unfortunately humans are not error-proof. And so for their safety, as well as to understand what's going on with them, and it helps with compliance as well. I mean, if you better understand what's going on with you, why you need to do certain things, the more you can have a voice in your healthcare, the more you can take charge of your health. If certain things are not right for you, then please, by all means, explain, where you're coming from.
So it's as simple as just asking your doctor a simple question, why am I being prescribed this? Is it okay with this other medication? Or, why am I receiving this type of treatment? It's little simple things that people don't do. Especially people don't realize that, there are thousands of patients that go through the hospital every day. For one doctor to keep track of everyone, I'm sure that physicians and the hospital does their best, but it only makes sense that we make a more proactive effort. So as far as infection control, what should patients know?
Definitely wash your hands. Infection, the main way things are spread is through hand touch. If a provider or anyone else comes to provide care to you and you haven't seen them wash their hands, please ask them to wash their hands as well. If you have any type of tubing that's placed, like such as an IV catheter placed in your hands, your wrists, sometimes in your inner aspect of your elbow, we've also have some patients with tubes that go into their bladders. Ask, do you need this? The earlier they come out, the better. Sometimes we can't take them out depending on the patient's case, but if you are prescribed antibiotics, for example, make sure that those are administered, you take them. Any type of wound that you have, dressing that you have, if it gets dirty, if it gets wet, ask that it gets replaced. If you go home, sometimes you'll have those on. Make sure you wash your hands before and after you touch that. And anyone who hasn't been trained on how to care for it, don't let them touch it. And they too would need to wash their hands. And if you have any visitors that may be coming that are sick, it's best if they don't come, just because if you're sick, that might kind of push you over the edge and then you get sicker. And we definitely don't want any of our patients to have an infection that they receive through healthcare. We want our patients to get better and not have any prolonged hospitalization because of an infection.
Okay, well, patient safety is a huge part of, accreditation, and so and it's just they have the Patient Safety Awareness Week and month every year. So if people, don't really know too much about this topic and they want to learn more, what resource can they go to find out more information?
The National Patient Safety Foundation is a good resource. They also have multiple links to other organizations as well, but I definitely would start there. There are some internet sites that proclaim to be healthcare related that aren't, so definitely I would start out with the National Patient Safety Foundation.
All right, well, is there anything else you'd like to add?
Speak up, and if you see something that doesn't seem right to you, or if you don't understand what's going on in your health, ask the questions.
All right, well, thank you so much for taking the time to share that with us. Patient safety, definitely a very important topic, especially for all of us who receive health care here at GMH and at other places throughout the island. Well, that's it for tonight's show. Don't forget, if there's a health topic you'd like to see us cover, email me at healthyliving@kuam.com. That's it. We'll see you next week, and stay healthy, Guam.
Closed captioning is brought to you by IT&D,